The Centers for Disease Control and Prevention estimates about 32.5 million adults in the United States have osteoarthritis, or about 10% of the adult population. Dr. Kyle Hubler, an orthopedic surgeon at UPMC Orthopedic Care in Williamsport, says osteoarthritis is the most common condition he treats.
Pain from osteoarthritis, joint pain from osteoarthritis, whether that is knees or hips, you can see it in some of your smaller joints as well. But that's the most common condition.
Dr. Hubler says in osteoarthritis, the majority of joint pain is caused by inflammation. The inflammation from arthritis causes pain and swelling. A lot of that inflammation can lead to stiffness and sometimes instability in those joints. Dr. Hubler says there are many things that can exacerbate those symptoms. He says a lot of the pain can be activity related, and at this time of year when the weather is changing, he also notices an increase in those symptoms as well.
I think it can be time to seek treatment whenever that joint pain is to the point where it's interfering with your day-to-day activities, your quality of life. And when your mobility is being affected to the point where those day-to-day activities become a struggle.
Dr. Hubler does a lot of robotic surgery when it comes to the joints. He says it's a newer technology in total joint surgery. It's essentially a robotic arm. He says he likes to tell patients that it is a fancy navigation program. The robotic technology helps doctors to make bony resections for a joint replacement as accurately as possible. It not only helps the alignment and the accuracy of the bone cuts, but also the ligament balance during surgery.
Most of the primary joints that we see and we do are candidates for a robotic procedure if they're a candidate for a procedure that's done with conventional instrumentation.
Dr. Hubler says with doing the robotic surgery, they don't have long-term outcome results yet. However, they do have midterm outcomes for robotic joint replacement, which tells them that in patients that have had robotic joint replacement versus those who have had traditional or conventional instrumentation, that those are very similar, if not the same. Dr. Hubler says there are some things that you can do to help maintain joint health.
Be overall as healthy as we can. To stay active, exercise, weight loss, I think is something that many of us can afford to do.
For this Healthwatch 16 report, I'm Justin Gick, Newswatch 16.